really showcase what we've been doing here today. And that is to put on a health and wellbeing event for prostate cancer and people who are affected with urology problems. We've had a whole host of healthcare professionals talking about their specialism.
And events like this really help them because you get all your different specialists who would normally see at different stages of their cancer pathway all under one roof, ready for you to ask any questions and clear any doubts you have. I think it's a fantastic event which has been organised very well.
We recognise that it's not just about the patient, it's about their family and their loved ones. There is a wide range of support out there.
Anybody with cancer faces financial challenges. That could be through their not being able to work, the cost of having cancer, so the cost of attending to have treatment, whether they're a carer, whether they've got a family to support. So Citizens Advice work with Macmillan Fund Citizens Advice to be able to give anybody affected by cancer welfare benefit advice.
When I had my regular yearly, in fact 6 monthly blood tests, they started doing PSA. As time went on, we noticed, me and my GP, and he said, oh, it's just gone up to 8 from 5. He said, maybe we'll just check that. And that's how it started.
I had the benign enlarged prostate, and then it was picked up with the PSA test, with the red flag flying there.
I'm being investigated for problems with my waterworks. It started with having to go very, very often, about every hour during the first week or so. My GP and the hospital are doing everything possible, and I'm extremely glad and extremely pleased with what they're doing.
I think I was expecting it. It was the process of high PSA, a scan, I think, and then the biopsy. So it was a gradual path, and when it came through as yes, is positive, I was ready for it.
Challenging part of the diagnosis is simply realising that all was not particularly well. So therefore, just them saying that there was cancer there is, it's a blow. It hit my wife more, I think.
I think not adding to their anxiety for starters, understanding the situation, understanding it takes time, and just being supportive, not judgmental.
Nobody's alone. We can always help, and there is always help. And they just need to reach out, and we've got a wide range of resources that we can signpost people to.
It's not a thing to be ashamed of. It's something that happens. You're not responsible for the way it happens, but you are responsible to making certain nothing worse happens. You must always consult.
It's the slightest of symptom, get in touch. So important. So these events just spread the word, and the more people who know about it, and even if one person here tells somebody else about it, the message is being passed on. Hopefully everybody here will be talking to somebody afresh and passing on the message that's being conveyed here very well today.
There are a lot of options to treat prostate cancer at the moment, as long as you've got favourable outcome disease and as long as you pick it up early. If you ignore it, it's not going to go away.